Good morning, P's and G's.
Yes, good morning, P's and G's.
So we wanted to share with you a bit about Corona in South Africa. The biggest challenge for us really is food security. As we're in lockdown, then people are getting really hungry in the townships, and the potential is that it could lead to violence. A few days ago, they were giving out food parcels in Centurion, and the queue was 3 kilometers long. So we're working with a team of different pastors in Crossroads to see how we can get food more securely to people. I had my first funeral a few days ago, which was quite distressing. The coffin all covered in plastic, and we're all wearing masks, and very few people are not allowed to sing. And it felt like that was quite a hard thing for people. With Green Anglicans, we're trying to take the opportunity to, while people are in shutdown and able to be on social media, to grow the environmental movement, to meet up with young people. We are meeting with young people from around Africa. We were supposed to have a conference in Nairobi, so we're taking the opportunity to connect with those same delegates and to try and grow the Green Anglicans environmental movement in other parts of Africa as well.
Yeah, so I'm mostly working with primary healthcare in city of Cape Town. We don't have as many elderly people as you guys, but most of our severe cases so far have been people in their 60s with diabetes and hypertension. But we're quite worried about the townships, a lot of very vulnerable people. One of my patients with COVID-19 was living in a shack on a plot with 9 other shacks and 24 other people, all sharing one toilet, outside toilet, and a tap. So getting people to isolate under those conditions is very difficult. And of course, we have a lot of people with TB and HIV, which makes them potentially more vulnerable, even though they're younger. So what I've been involved with is I've been working a lot with community health workers, trying to get them to deliver medication at home so people don't have to go to the actual primary care clinics. We've also been reorganizing the primary care clinics in Cape Town to have like a hot stream for COVID and a cold stream for non-COVID patients with screening, like in the car park at the entrance. Um, We've also setting up 2 field hospitals, an 800, I think 50-bed field hospital in the city centre, and then at least one more 300 and something bed hospital in the east of the city. And family medicine is going to be probably staffing those hospitals. Um, yeah, the other big thing that we're involved with is community screening and testing. And we've been focusing particularly on hotspots in the sort of more vulnerable communities and trying to identify cases there. So that's what I'm doing. That's what you can pray for. And we hope that our surge will not be too horrific, which we expect to happen in June now.
So do pray for us. The next few weeks will, as you know, will be very rocky. We feel like we're waiting for the tsunami to hit. Strength for everybody, protection for the people in the communities, and where social distancing is really, really hard, if not impossible. I'm particularly praying for our community who are living with HIV and TB and diabetes, that they would not be too severely infected and affected by COVID-19. God bless you, and thank you for praying for us as we are praying for you.
Bye bye.